Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great tip for those of you with spondylolisthesis of the lower back, a walking tip from my new book, Walk Away Back Pain, that teaches you how to recruit your lower fibers of the erector spinae during the walking cycle to help train your spondylolisthesis vertebra to pull and check backwards to prevent the forward slippage stress that many times aggravates spondylolisthesis pain. Hope you enjoy. So one of the few muscles that can exert a backwards pull on the spondylolisthesis vertebra that's slipping forward are the deep fibers of the erector spinae muscles, particularly down low in the lower back at L4 and 5. The way their fibers attach to the vertebra, if contracted, they can help pull the vertebra back if used correctly. Now, the erector spinae, which run north and south on your body, about an inch to the side of the midline of your spine, when they contract, they exert not only a backwards pull, but also an arching effect. If you've seen any of our other videos on the channel, you know that arching of the lower back, or hyperlordosis, many times is going to be one of the prime irritants of spondylolisthesis pain. So the way we negate this arching effect and capitalize on the backwards pulling effect, not only during walking, but during any type of exercise, is to use posterior pelvic tilt positioning. Now, if you've seen any of our other videos, we've described a neutral spine where we tilt the pelvis back and forth and find an amount of pelvic tilt, which is tailbone under and pubic bone up, or rocking the pelvis, that feels most comfortable on the lower back. For most spondylolisthesis sufferers, this means some degree of posterior pelvic tilt, meaning the tailbone tucks under and the pubic bone tucks up, flattening the curve in the back. Once you get to that neutral spine pelvic tilt position, you want to use your erector spinae muscles by tensing, not moving, the pelvis backwards where it came from. In other words, once you tuck the tail under to a comfortable degree, you're going to tense it back upwards without moving it, because you've already found neutral spine. So you don't want to disturb that actual position, but you want to use tension as if you're trying to tilt it back up the other way. When you do this and you put your fingers an inch to the side of your midline in your lower back, you're going to feel those muscles tighten. Those are the erector spinae muscles and tendons tightening under your fingers. As they tighten, they're producing a backwards pull in the vertebra, which is very important. And the more you do that exercise, the more you're going to be conditioning the endurance effect, and it's going to help relieve many times spondylolisthesis pain. You're going to plug that into your walking cycle, because walking is the most common daily activity we do besides breathing, using our full body. So why not use this while we walk so we don't have to have separate rehab time during the day? Plug it into what you're doing already, which is walking around. Without walking, you're probably training improper mechanics and causing the pelvis to fall into an anterior tilt and causing that spondylolisthesis to drive forward with each step, especially as the leg comes behind you. So let's correct that and practice some new mechanics to help with your spondylolisthesis pain, which will take no extra time at all because you're already walking during the day. So to do this, put your pelvis into that neutral position with a certain amount of tail under that feels most comfortable for your back. At the beginning, you can use your fingers to monitor the back muscles as you tense your tailbone back up, and you're going to hold that tension as you walk. Now, as you walk and one leg comes behind you, the erector spinae on that side is going to contract. It helps out, as well as the other side, with extension. As a leg is stepping forward, the erector spinae has a tendency to relax to allow hip flexion to occur. So you want to make sure you keep that tension on, and as I said from the beginning, use your fingers to monitor. Just walk around a few steps with your fingers there and hold that tension. Get used to holding it through the gait cycle as one leg comes forward and one leg back. Doing this is going to help to increase that endurance conditioning effect on the deep fibers of the erector spinae, get your body used to having a checking effect or a safety pull back on that spondylolisthesis vertebra, and many times is going to help with chronic spondylolisthesis pain. If you like this video on spondylolisthesis walking, feel free to subscribe to our channel. We've got a lot of great videos out there to help you with your pain. Questions or comments, write in. I'll do my best as always to answer them. Give me a thumbs up if you'd like me to help share this valuable information with others. And if you're looking for a great walking program to help your spondylolisthesis pain, full of walking tips, supportive exercises, nutrition, even biopsychosocial complex factors with chronic lower back pain, which is the way most low back pain research is going these days, check out my new book. It's got over 200 references-based ideas on walking for back pain, called Walk Away Back Pain, available at the painfreeandfit.com website. I hope this video on walking with spondylolisthesis pain by using your deep erector spinae muscles helps you with your chronic lower back symptoms.